Well, let's begin this morning with that breaking news on Johnson & Johnson's COVID vaccine. Yahoo Finance health reporter Anjalee Khemlani joins us now with the details on the FDA's statement this morning. Anjalee.
Hi, Myles. Yeah, so we heard from the FDA this morning that they're recommending a halt on the use of Johnson & Johnson's vaccine, as you noted, on reports of six reports of blood clots out of more than 6.8 million doses that have already been administered. We're going to hear more from the FDA at around 10 o'clock today, but as it stands right now, that's as much information as we do have. We know that similar concerns did spur a halt of the vaccine for AstraZeneca in Europe, and while it's too early to tell if there is similarities because of similar platforms, health experts are watching this very closely right now.
All right, well, let's bring in someone who's an expert in this field for a little bit more color on today's developments, what we do and do not know so far. We're joined now by Dr. Paul Offit. He's the director of the Vaccine Education Center at Children's Hospital of Philadelphia. Dr. Offit, thank you so much for jumping on this morning. So I guess just start with talking us through what you understand from the FDA and CDC statements this morning and what the public is to think about this news from those agencies.
Well, we knew that the AstraZeneca product, the UK product, which is a similar platform to the J&J product, had a problem in Europe, where roughly 1 per 250,000 people who got that vaccine could have these kinds of blood clots, meaning so-called central venous sinus thrombosis, or said another way, a blood clot in the brain. That caused some European countries to not give the vaccine. It caused others to say, okay, we're just going to give it to older people who seem to be at lesser risk of this problem. And so, but the fear that was always there was that because the AstraZeneca vaccine is a replication defective adenovirus, specifically a simian adenovirus, and this, the Johnson & Johnson vaccine, is a similar platform. It's just a human adenovirus. Could this be a class effect? And so now we're finding that it is a class effect, that it looks like there was roughly 1 case of these kinds of blood clots in the brain per million people. It's a very, very rare phenomenon, but it's real.
Dr. Offit, we know that we've heard of specifically, like you're pointing to, AstraZeneca as well as now Johnson & Johnson with this issue. There were also concerns earlier of the platform and its ability to reduce immunity over time and not being effective, say, for a second dose. Are we going to be looking at maybe just specifically turning to the mRNA vaccines now and just completely wiping out these?
I think for right now in the United States, we're going to be relying on the 2 mRNA vaccines of Pfizer and Moderna. My understanding is from the Biden administration is that we will likely have enough of those vaccines to vaccinate every American, certainly by the summer. So I don't think we necessarily need to rely on the Johnson & Johnson vaccine, which is fortuitous.
Doctor, for those who have taken the Moderna or the Pfizer vaccine, should they have the same concern as the folks that have taken the J&J vaccine?
And I think that's the good, if there's any good news in this, it's this, that when J&J did their trial and they submitted it to our FDA Vaccine Advisory Committee, that was a 44,000 person trial, 18,000 in the United States. So you're not going to pick up likely a 1 in a million problem. You're only going to pick that up after the vaccine's already released. But the point is people are constantly looking. The CDC, the FDA, the companies are constantly looking to make sure there's not even a rare side effect. So by seeing this being picked up with Johnson & Johnson vaccines, frankly, you can be reassured that it's not happening with the mRNA vaccines because we've always been constantly looking at those vaccines as well. I think this is a class effect associated with these replication defective adenoviruses and have nothing to do with the mRNA vaccine.
And Doctor, we know that in Europe, a lot of countries have completely halted the use of the AstraZeneca vaccine and specifically targeting that younger female group. We saw a similar trend with the reports from Johnson & Johnson. Do we anticipate having similar guidelines here in the U.S.?
We'll see. I think it's going to be up to the CDC and the FDA to decide what they want to do about this rare but real side effect. We do have other options here. I think that the thing that's the saddest about all this, the thing that kind of breaks my heart, is that AstraZeneca was committed to making a vaccine for the world, cheaply for the world. And, our country is only as strong as the weakest country out there. We still give a polio vaccine to children every year in this country, even though we haven't had a case of polio since the 1970s. We do it because the polio still exists in Pakistan and Afghanistan. We're still going to be dealing with this vaccine in the United States until this virus is controlled in the world, and AstraZeneca had made that commitment. So it's hard to watch that product stumble in the same way it's hard to watch Johnson & Johnson's product stumble.
Well, and Doctor, as you mentioned, there had certainly been, monitoring by the FDA and CDC of these potential situations related to folks who had received the Johnson & Johnson vaccine. I guess we'll learn more from these organizations as we get through today. But as you see it now, I mean, how cautious or how aggressive were the FDA and the CDC in coming out and making this kind of statement rather than monitoring these? And, because now it's out in the public. Now we're leading the program with it. All the national news is going to be talking about this. And I think it changes the perception around the vaccine, perhaps rightly or wrongly.
I think the FDA and CDC were right to do this. I think this was the prudent thing to do. They're going to look hard to see whether or not the incidence of these blood clots in the brain is as common in people who didn't get a vaccine as did get a vaccine. But I think there's enough information now, both with the UK AstraZeneca vaccine, with the J&J vaccine, to believe that this is a real but very rare effect. And so I think they were prudent to do that.
Doctor, do we know specifically right now, the concerns of people who've already taken the vaccine, what they should be looking for, or any sort of trend of the people who did report these incidences? What can we tell them, and should they continue to be concerned in monitoring themselves if they've received J&J vaccine? Right.
So these clots appear usually within 14 days, usually between 6 and 14 days. And the symptoms that one looks out for are headaches, difficulty breathing, abdominal pain, leg pain. Those are the 4 most common symptoms. But if you get past roughly 2 weeks and don't have any of those symptoms, and these wouldn't be subtle symptoms, then you didn't suffer that 1 in a million chance of having a problem with this vaccine.
And as you mentioned, we might not need to rely on the J&J vaccine now that we have so many doses of the other two. But right now, we also know that, at least for the federal government, the Biden administration has been very focused on specific numbers and targeting that 200 million doses. Do you think that this is going to interrupt that goal, that target?
I don't think it's going to interrupt it much. I mean, we've given, well over 100 million doses here. I mean, the J&J was about 6 million doses. I think between Pfizer and Moderna, we're going to be able to vaccinate all Americans by midsummer.
And then, Doctor, finally, before we let you go, and zooming out from today's news, a conversation we were having just internally as a group over the last couple of days was how the public is maybe understanding or not quite understanding exactly what those efficacy data mean, whether it's the 95% from Moderna, the 66% from Johnson & Johnson. I think there's been some confusion, some reporting that's been confused around it. How would you explain that to a lay audience like myself who's signed up for the Moderna vaccine and thinking about what that's going to mean for me, going forward here?
Right. So there's a difference between efficacy and effectiveness. Efficacy is the term that's used for the studies, the so-called phase 3 studies. And those studies are done under highly controlled conditions. I mean, the people who are giving those vaccines, storing them, handling them, putting them in the refrigerator, taking them out of the vial are highly trained in exactly how to do that. When you get into the real world, there's often some slippage. So, when the Pfizer vaccine, for example, is shipped and stored on dry ice, which is not something we typically do. So you want to see what the real world data are. The real world data are the so-called effectiveness data. And, the CDC recently published something in the last couple of weeks looking at the effectiveness data and found that for the mRNA vaccines, they were still highly effective, about 90% effective after 2 doses. So that was good news. It told you that these are pretty much foolproof or fail-proof in terms of getting out in the real world.
All right. Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia, and Anjalee Khemlani, thank you both for joining this morning. Doctor, really appreciate you being so generous with your time on this very busy day.